Right. So if you have read and understood, considering its surgical and administration, kindly tell me if you can identify these images. What are these small arrows? Is there any, does that signify anything? Some arrows are thin, some arrows are thick.
Yes, ma'am. Some are the arrows which are thin are suggestive of the sutures, cranial
Yes,
sutures,
yes.
and arrows which are thick, this might be suggestive of some the areas of bone which are thick.
No, no. Would you be able to identify, because it's pointing at something, structures. Have you heard of diploic veins?
Yes, ma'am.
What are these?
These are the veins which connect the diploid spaces of the brain to the dural venous sinuses.
Yes, diploid spaces to the dural. Okay. What did you say about the sutures? What are the sutures which are present in the skull? And at what age do they fuse?
Yes, ma'am. We have a coronal suture anteriorly, lambdoid suture posteriorly.
Yes.
Also, we have the asteron and pterion,
Yes.
where all the four bones meet.
Yes.
And anteriorly, it is called as pterion, and posteriorly, it is called asteron. These sutures usually fuse at 18 to 20
months, right? Okay, if a child is born with the fused sutures, what does it called?
It is called as craniosynostosis.
Very good. Okay, can you please tell me what is the significance of pterion, since you have mentioned it?
Yes, it is the portion of the bone where portion of the skull where four bones fuse.
Yes,
The
but
parietal bone, frontal bone, temporal, and yes, ma'am.
no, but
It
the
is
clinical significance.
yes, ma'am. It is the thinnest portion of the
No.
cranium, behind which the meningeal
Yes.
middle meningeal.
Yes. Yes.
Yes,
And it is the area where you'll have the extradural hematoma. So that's why it's significant. Can you please tell me about the, right, can you please tell me about the cavernous sinus?
Yes, there are two cavernous sinuses which lie lateral to the sella turcica.
Yes.
It has important contents in its lateral wall and the medial wall. Laterally, it has oculomotor, trochlear, and ophthalmic and maxillary root of trigeminal root or trigeminal nerve. And medially, there is internal carotid vessel along with abducent nerve.
Very good. Yes. This drains into what, please?
This drains into the inferior and superior petrosal sinus.
Yes,
and intercavernous sinus, which connects both the cavernous sinuses, which ultimately drains into sigmoid and
internal vein. Okay. Can you please tell me what is cavernous sinus thrombosis? And
yes,
what are the signs of it that you should be careful about?
Yes, when the cavernous sinuses, they are drained, or the facial and superior ophthalmic vein drains into cavernous sinuses. Whenever there is any infection of the dangerous area of the face, the thrombosis can travel into the cavernous sinus, as these veins are valveless.
Yes.
And it leads to the symptoms such as paralysis of oculomotor, trochlear, and abducent nerve, along with painful altered vision and painful swollen eyes.
And yes, all right, good. You mentioned about the dural venous sinuses. Can you please tell me how many are these and how would you classify them?
Yes, ma'am. There are 4 unpaired and 6 paired venous sinuses.
Yes.
These dural, they're classified as their position in relation to the skull.
Yes.
There is superior sagittal sinus, inferior sagittal sinus, straight sinus, and occipital sinus. These are unpaired ones. And the
Yes.
paired ones are sphenoparietal sinuses.
Would you be
Then,
able to identify here in the image that you're looking at? Can you tell what is one?
yes, ma'am. One is the confluence of sinuses.
Okay. Two, please.
Two is straight sinus.
Yes.
Then three is, ma'am, it's the superior sagittal sinus.
Yes.
And four is sigmoid sinus.
Yes.
5 is inferior petrosal sinus. 6 is superior petrosal sinus. 7 is cavernous sinus. And 8 is sphenoparietal sinus.
Okay. Can you please tell me where the straight sinus drains into? From
Yes,
two, if you can tell me both.
yes, ma'am. Straight sinus is formed by inferior sagittal sinus and great vein of Galen, which drain into confluence of sinuses.
Very good. And if you can tell me the location as well.
Yes,
Pure
ma'am. It
border.
is.
Yes.
Yes, ma'am. It's just located just on the cerebral tentorium
Tentorium
cerebelli.
cerebelli. Yes. Okay, good. Can you please tell me what is the significance of sigmoid sinus? Why is it called sigmoid?
Because of its shape, ma'am.
Shape.
It's
Very good.
curved.
Where is it
Yes.
located? Right.
It is located just near the inferior part border of the petrosal temporal bone.
Yes. Posterior cranial fossa, sigmoid sulcus. Okay. Can you please tell me from where it drains and where it drains to?
Yes, ma'am. It drains from the from the straight sinus. Oh, sorry, ma'am. A transverse
No.
sinus,
Yes. And
and it will drain
inferior
into
and superior petrosal sinus as well. So it takes all that and then it drains into
it would drain into inferior petrosal
no,
sinus
jugular
and
pulp of internal jugular vein. So that is, yes, that's why it is. All right. Okay. What more can you tell me about? What is this? It's not labeled, but then can you tell me what that is?
this is the plexus of wings, vertebral
Yes.
basilar plexus of wings.
Intercavernous sinus. What is intercavernous sinus?
These are the sinus which connect the both the cavernous sinuses
Yes.
and also
If you have to do a borehole, and then can you please tell me the layers that you'll come across from outside to inside?
yes, ma'am. There would be skin, subcutaneous fascia, aponeurosis, then loose areolar tissue, periosteum or pericranium, and if it's made in the temporal region, then there would be skin, subcutaneous area, aponeurosis, the aponeurosis covering the temporalis muscle, then temporalis muscle, and then periosteum, and then outer and inner table of the skull, followed by dura mater.
Okay, Bell has gone, but can you please tell me how the cerebrospinal fluid is formed?
Yes, ma'am. So yes, it drains from bilateral, both the first and both the lateral ventricles. From
Yes.
there into the foramen of Monro, it would go into third ventricle. From there, aqueduct of Sylvius and the
Yes.
fourth ventricle.
Yes.
At the floor of the fourth ventricle, there is median foramen of Lashka, lateral foramen Lashka, median
Yes.
foramen of Magendie.
Yes.
From there, it goes into the
Subarachnoid space. Then to arachnoid villi and then space at the sinus. Good. Very good. So if anyone wants to look at the answers, so these are the answers. Yes. So this is this intracavernous sinus I asked you. It's not labeled here. I normally don't ask, but I asked you. But your preparation was good. Thank you.